Hi, everybody. Thanks for joining tonight's Healthy Lifestyle Talk. Tonight, our talk is going to be hosted by Dr. David Plank. Dr. David Plank is certified by the American Board of Plastic Surgery and specializes in facial and full body cosmetic and reconstructive plastic surgery. He's also contributed a chapter to a textbook and has 16 peer-reviewed abstracts and articles published in the field of plastic surgery. Dr. Plank regularly gives talks on the medical field to middle school students, and tonight he's joined us to give us a little more information about some of the work he does, and I think specifically on skincare. Hence the title. I will go ahead and hand it over to Dr. Plank now to go ahead and get the talk started.
All right, thank you, Scott. Welcome, everybody. I'm coming live from Orlando, Florida, the Sunshine State. Where we wear a lot of sunscreen out here. And that's what my topic's going to be about tonight, talking about SPF, where you wear sunscreen and clothing and such. So basically, this is a very 30,000-foot view talk about how to take care of yourself in the sun. You guys live in the high altitude with a lot of sunny days. And Florida, it's the Sunshine State. So we have something in common, except we don't have any mountains. Anyway, so my talk is SPF a day keeps the wrinkles away. And I'll just go briefly talking about some genetic factors that are influencing how we get skin cancer and wrinkles and things of that nature. So there's some personal factors, obviously genetics, it's how God designed you. Environments, where I live, it's sunny all the time. Where you guys live, it's sunny all the time, but you have the advantage of high altitude that can cause increased sun exposure, increased radiation exposure to the sun. And also you have the snow in the wintertime, so the ground reflection causes increased radiation from the sun bouncing back. And also just how you live your life unprotected from the sun, such as not wearing appropriate clothing and sunscreen, you get greater risk as well. So you can see here, this is called Fitzpatrick skin types. This is what we use in plastic surgery and dermatology. Just basically describes how somebody's skin reacts to the sun. And almost this is like a ladder of how people evolved out of Africa. So down here at the very bottom is our Fitzpatrick type 6 individuals. And as humans evolved out of the Rift Valley in Africa, they moved north and they just lose that pigment that protected them from the sun. So up top, you have your more Irish type individuals that burn. And as you move down, they retain some of that pigment, the melanin that helps protect the skin from sun damage and that nature. So this is basically how we describe individuals scientifically in the medical field. So you can kind of just put your face, your skin tone next to that individual, and you can kind of figure out what skin type you are. So like these individuals, of course, the lighter the skin, fairer the skin, blue eyes, fair skin, those individuals have a higher risk. So blonde or red hair, blue eyes, green eyes, fair skin, those are individuals that burn easily, have moles. You've seen those individuals have a lot of moles, and dysplastic nevus on them have increased risks. Also individuals that have family members with melanoma. Here in Orlando, or here in Florida, where I trained in at University of South Florida for my plastic surgery training, I trained at Moffitt Cancer Center, and I believe that's the #1 place in the country for melanoma treatment. So we saw a fair amount of melanoma, different treatment plans. We also did a fair amount of clinical trials there as well, which is relatively interesting. I don't know how far long it's been going on, but they've been trying to use your own immune system. They take a piece of melanoma, grow it into some antibodies and give it back to you as a antigen, and your body develops antibodies to the melanoma. So I'm not for sure how long or how far that's been going on. I don't know if it's reached the market or not, but it's very promising. So again, environmental factors. Again, you guys are at high altitude. I'm at very low altitude. I think I'm at like 20 feet altitude right now, but I'm closer to the equator. So as individuals move further away from the equator, less need for melanin. But as you get closer to the equator, increased intensity of the sun for direct rays. However, at altitude where you guys are at, even higher up, more UV exposure, increased risk for skin cancer and climate. Sunnier days. I grew up in Ohio. It was pretty much gray from like October to like May. Then I moved to Florida for 6 years. It was sunny all the time. I loved it. Then I moved to Pittsburgh for a year. Did my hand fellowship, and it was gray again. It's like somebody just pulled a gray blanket over the sun for the last like 8 months. But then moved back to Florida, thankfully. So these factors, which all play a role in how much UV exposure you have. So we're talking about sun exposure, UV exposure, and that's what we're trying to prevent and mitigate, is preventing your skin getting damaged from UV sun radiation. So there's main two types of skin or UV radiation, UVA and UVB. So little schematic here shows that UVA causes aging and UVB is burning. So it goes at different levels. So you see people that drive a lot, truck drivers, that show left side of their face is aged versus the right. I see it all the time in Florida. People that grow up here in Florida usually are higher risk for skin cancers, but the left side of the face looks more aged than the right side. And most of the skin cancers come from UV radiation. And for some reason in Florida, there's a fair amount of tanning beds that they have in Florida, which blows my mind. And that has an increased UVA intensity, 2 to 3 times that. So I find that interesting that people would do that in Florida. So suntans and sunburns, as many as you know that do suntan, that's your body's response to the injury that you're receiving from the ultraviolet radiation to your skin. But in the meantime, it's trying to protect itself. It still gets some sun damage. The radiation will affect some of the DNA, some of the skin cells, the keratinocytes, squamous cells that make into skin cells that eventually become damaged. But again, all this exposure, chronic exposure, day-to-day exposure, even from when they're young, even children, beginning to have signs of sun damage. And there's some relative risk if you do intense burns when you're younger. So intermittent burns. I used to do this in the summer in Ohio when it was sunny out. I never wore sunscreen, so I got burned multiple times. So I see my dermatologist here in Florida to make sure I don't have anything growing on me. So I've touched on this briefly in the last slide about skin cancer formation. UVA and UVB are basically are ultraviolet rays that can cause DNA damage, can cause cellular damage. And the body tries to fix it through DNA repair mechanisms, but sometimes it misses, and you can get an aberrant DNA, which then propagates and proliferates into skin cancer, like basal cell, melanoma, and squamous cell. The youngest individual that I took care of melanoma was 17. So he had this mole on his face, but over time, living in Florida, not wearing sunscreen, it eventually turned into melanoma. Here's the types of skin cancer I typically see: basal cell, squamous cell. These two are fairly benign if they're caught early enough. They don't spread that easily to other parts of your body. If they do, it's through the lymphatic system to your lymph nodes. Typically, people who have large basal cell or squamous cell that spread are immunocompromised, patients that are liver transplant, patients that are not taking care of their AIDS, HIV, they're not taking their HIV meds. And then the biggest player that's really dangerous is the melanoma. There's several different types, but I'm not going to discuss, but this is the one that I treat very aggressively in my office and also in surgery. These squamous cells and basal cell can easily be removed with just clinical margins, about 2 to 3 millimeters on each side, can clear the skin cancer. But melanoma, typically you have to measure how deep it goes. It's called the Breslow depth. So anything thicker than 1.0 millimeters has to get a lymph node, sentinel lymph node biopsy, which I do. Anything after that, you have to get a partial lymphadenectomy, but they've kind of gone away from that now because it really doesn't change the medical plan or the survival curve of those patients. So mainly most people have a mole that changes and they come in and see the dermatologist, and then they send that off as a specimen and as a biopsy, and then they come and see me to have it removed. So with these are benign. They can sit on somebody for several years and they think it's a bug bite, a bump, and they don't do anything about it. So these are relatively, they're still skin cancer, but relatively benign. But the melanoma is the kicker you have to take care of quickly. So these are the signs to check for melanoma. So asymmetry, a lot of the people have moles and they'll come to me and say it just kind of changed drastically. Got irregular, it got real dark and black. It used to be brown, but then it turned black. Then the diameter usually is about 6 millimeters, and they say a pencil eraser, but nobody really uses pencils anymore unless they're using their Apple Pencil, and that's probably less than 6 millimeters. And then evolving, meaning it's just constantly changing. It becomes corrugated or cobblestone to look. So those are the main things that most people come in and see me about. And then when I see patients that, for whatever reason, they're in there for another issue, I'll simply biopsy that. And I usually do a punch biopsy that gives the thickness for the Breslow depth. So one of the ways to mitigate these complications is limit your time in the sun, or you can find shade, portable shade, especially in Florida. People have those really large those canopy tents that they set up at the beach. You can hang out under those. And then I talked about the car window glass only blocks the UVB, but not the UVA, and UVA causes aging, which demonstrates over the years of people having their left side of the face looks older than the right side of the face. And then you have clouds that block a certain percent of the UV coming from the sun. Check the UV index daily. I mean, that's, with you guys out in California, it's pretty much 10 and above almost every day out there, unless you're having a, as they call a, what do you guys call, instead of a rainstorm, you guys call it a atmospheric river. I find that interesting. So when it's you're having an atmospheric river out there, there's some clouds. That's when it drops down low. And then again, you guys are way up high, higher than me. So when you get up some of those peaks at 13,000 feet, you have a significant increase in UV exposure. So when you're climbing, hiking outside, snowboarding or skiing, got to wear that sun protection. And I'll get into that right now. So the clothing, I'm a big fan of the clothing because you can wear it over and over again. It's kind of the higher quality ones are a little bit more pricey. There's a company called Coolie Bar that I always recommend patients. It's higher fabric. It doesn't stretch after multiple uses and after you wash it. But the higher the number is, very similar to SPF, but they have this UPF rating. But it's very similar. Anything 50 and above blocks pretty good. So we know here from the last 2 years, clothing works and prevents sunburns and sun tanning to our body. So you can have a regular t-shirt's only about 5% protective, but that's better than nothing. But if the long sleeve shirts, the quality of the attire now and the material is a lot better than what it used to be. More breathable. not as hot, and a lot more comfortable now as well. I used to have those back in the early 2000s when I moved to Florida, and then now they're higher quality and they feel a lot better, because they used to be real itchy when you get outside in the sun. So highly recommend clothing and hats as well. And I just described what the clothing UPF means. And sunglasses is very important too. There's a certain level of, you can get some melanoma that presents in the retina, which is problematic. And so you want to have a good pair of sunglasses that blocks or protects your eyes from cataracts and macular degeneration. And then sunscreen, I say SPF 15 or more. The main thing is you just have to reapply it all the time. Down here in Florida, it's hot and humid, so you're constantly sweating it off. This reapplication is very important. Where you guys live, it's relatively high desert, dry climate. You still sweat, but it's not as steamy up there than it is in Florida. But you could still reapply, and it would probably last a little bit longer than it does down here in Florida. So it's very important for sunscreen to layer it on, especially in the morning and then right after lunch. So I like the zinc oxide products. They've come a long way since I grew up in the 80s, where they had the zinc oxide that came in different colors, and you put it on your nose and it's like pink, red, blue, white, and it just looks like chalk on your nose. But nowadays they have what they call a clear 50, or the clear zinc oxide that absorbs fairly well. I mean, it still has a little haze to it on all skin types, but this is the best because it blocks UVA and UVB rays. So I tried to find an image where it showed UV light bouncing off somebody wearing zinc oxide, but this is a kind of a diagram that kind of demonstrates that. So if you wear this all the time, get your kids to start wearing it at a young age, like my kids, they'll be protected down the road. So with skin cancer, early detection is key. Whenever I see patients, they ask me what this is. I kind of make an educated guess. You know, a lot of times if a basal cell looks like a basal cell, I'll just take it out. More times, 9 times out of 10, I'll just biopsy it and then let the pathology give me a final diagnosis. Most of these that are found early, which most of them are, most people are dialed into skin cancer now because of the push in the late 90s, early 2000s with melanoma and skin cancer awareness. But most of them are relatively treated. I would say about 95% of the skin cancers that I take care of, I can take care of in the office because the patients come in early and I can treat it in the office just in the local. And anything larger, I just take it out in the operating room. But that's very rare. So in summary, just protect your skin with clothing and sunscreen. Clothing is very important, I think, because then it cuts down the cost longitudinally. If you're wearing comfortable clothes, you're going to wear it. It's like if you buy nice clothes, you're always going to wear those nice clothes. The ones you don't like to wear, you just put in the back of your closet. Sunscreen reapply often, especially the ears and the nose. That's the most destructive. I've been wearing sunscreen since probably my early 20s. Because I saw a guy when I was in college at Miami of Ohio, and he had half an ear, and it was somebody's grandfather. And I told myself I'm always going to wear sunscreen. So I'm on my own test subject on if sunscreens longitudinally prevent skin cancer. And then monitor for skin changes. Most people come in to my office, they already diagnosed themselves by using Dr. Google. But most of the time I just send it for a biopsy. And most of the time they're pretty correct on their diagnosis based on like the hundreds of thousands of images they see on Google. And with that, that's all I have. I kept it short and sweet in between a TikTok video time and a high school class time. So short and sweet. Anybody have any questions?
Hi, Dr. Plank. You had a couple questions in the chat, actually. One of them, the first one, I guess we'll start with this, is how long does it take out in the sun until you start to get a sunburn?
That's variable from individual. I think most people kind of realize they feel it right away. It depends on your skin type, your Fitzpatrick. So for me, if I'm out in the sun for about an hour out in Bishop, I can feel I'll probably get a sunburn. People that are darker pigmented, a little bit longer, a little bit lighter skin tone, pigment, probably a little bit shorter time. So it's variable. Everybody kind of knows what their limit is. They'll tell you, I always burn. I never suntan, or I just go straight to suntan. I never burn.
The next question we had was, is there any advantage to using SPF more than 15?
There's a calculation you can do based on the number of minutes and gives you a length of time. But it seems that I always tell patients SPF of 30. That's pretty reasonable. It's like the number of hours times 30 gives you the number of minutes before you start burning. Usually it's about 4 hours. So then you have to reapply about after 4 hours using SPF of 30. But anything more than that, usually it's more expensive. But I always encourage using the zinc oxide because it lasts longer. There's other products out there that don't have zinc oxide. And what those chemicals do is they absorb the UV radiation to prevent it from entering in your skin. It doesn't really bounce off your skin like the zinc oxide does. But those are pretty good. I like Neutrogena. I just like the smell of it. A lot of them are all the same product because they all have to pass the same standards with the FDA, and they've all been kind of vetted through all the years and decades of using the same products. But just right now, it's just basically based on smell. So whatever your fancy is, I do just go to the Vons or Dwayne's or Rite Aid. You can just kind of go and pick and choose what fragrance you like the best.
Great. I don't think we have any more questions in the chat. Oh, sorry, we got one more here. How long in the sun to get your vitamin D?
Vitamin D is a very slow reacting molecule. So it goes vitamin A, D23 to D25. You're really testing my biochemistry from about 15 years ago. But it takes about 20 minutes to 30 minutes in the sun to get a fair amount of vitamin D. I remember in med school, there's a lady that just had a vitamin D deficiency, even despite having supplementation with vitamin D. She actually went to a tanning bed and got her vitamin D that way. I don't recommend that, but she had pretty significant vitamin D deficiency. So about 20, 30 minutes, 40 minutes to get a sufficient amount of vitamin D, but it's longitudinal. Okay. So when you guys live out in Bishop, you're always exposed to the sun. Okay. So it's a kind of a chronic exposure that you've already probably met it if you're out in the sun at least 20 minutes a day, 30 minutes a day. What really affects is the people that live in like Pittsburgh, where I lived a year and there was no sunshine. Those are the individuals chronically that are deprived of sunshine and a conversion of vitamin D. And they find that in the last couple of years, they find that people are more sick when they have a vitamin D deficiency. So when they increase their supplementation with vitamin D, they get less sick.
Great. And then the last question I can see here in the chat is it ever too late to start this type of care?
No, never too late to start. So you're looking at individuals that are in their 50s that I see. They grew up and they use baby oil and I think it was betadine, baby oil for sure, and some kind of other mix that they used in Florida. So those people have a little bit of skin cancer, but they started, once they got their first skin cancer in like their 30s and 40s, they started using sunscreen. So you're like protecting yourself from future exposure.
Well, Dr. Plank, this is Joy Inglade. Thank you for the talk. Really appreciate the information. I can totally identify with you. I grew up in Michigan. We would go to Florida every spring break, where I would go to the tanning bed beforehand to get a good, quote, base tan to protect me from the Florida sun. So it's just amazing how much more we know now and how those habits have changed. So thank you.
You're welcome.
I think that's all the questions we have here, but if there's nothing else, I think thank you very much, Dr. Plank, for giving this talk. Really appreciate your time and then giving the talk to this community. If anyone wants to watch the video later, it will be uploaded onto YouTube, so you can view it at any time you like. You can also see it on Facebook. This will all be posted up tomorrow, and you can watch it then.
Thank you so much. Thanks for having me.